morning. Thank you for virtually joining us today as we celebrate Trinitas Regional Medical Center joining RWJBarnabas Health. This is a very exciting day, an exciting day indeed. I'm very proud to be joined by Barry Ostrowski, the President and Chief Executive Officer of RWJBarnabas Health, Vic Ritchell, Chairman of the Trinitas Regional Medical Center Board of Trustees, Mark Urson, Chairman of RWJBarnabas Health Board of Trustees, Sister Maureen Shortesy, General Superior of the Sisters of Charity of St. Elizabeth and Vice Chair of the Trinitas Regional Medical Center Board of Trustees. And thank all of you for being with us today as we celebrate this great event. We are very proud to be joining RWJBarnabas Health to increase access of high-quality health care in northern and central New Jersey. Despite the COVID-19 pandemic over the last 2 years and all its challenges, Trinitas and RWJBarnabas Health forged ahead to make this happen. Trinitas is no stranger to affiliations and mergers. Elizabeth General and Alexian Brothers in 1990, Elizabeth General St. Elizabeth's Hospital in 2000, creating Trinitas 22 years ago. Trinitas has many similarities with RWJBH. We share similar values, mission, and commitments to providing care to underserved and urban communities. We've actually been working with RWJBH for over 40 years with our affiliation with Newark Beth Israel for pediatrics and maternity care. RWJBH is the largest academic health system in the state, which furthers our own commitment to academics and innovative care. We are a Catholic teaching hospital, and we will remain so, and we're looking forward to expanding our clinical and academic programs with the Rutgers Medical School. Our School of Nursing is one of the finest and largest in the United States, and we supply nurses not only to Trinitas, but also will be providing them to RWJBarnabas Health network and system. The students will have available to them additional clinical sites and more employment opportunities. There are numerous benefits that we will see with this affiliation. Expanded benefits for our providers, increased employee benefits, more specialists to serve our community, investments in our equipment, infrastructure, information technology, recruitment, and clinical programs. But what isn't changing? Our culture is not changing. Our sense of family will not change. Our dedication to serving the community, including the most vulnerable, will not change. So where do we go from here? Our collaborative work will continue. We'll keep you, our teams, and communities informed and updated on how the progress is being made. We are thankful for your support and partnership, and you made this happen today. I would like to ask Vic Ritchell, the Chairman of the Board of Trinitas Regional Medical Center, to come up and share some remarks. Vic?
Well, thank you very much, Gary, and I echo Gary's comments. We feel very positive about this wonderful joining of our two institutions today. As Gary said, our cultures are so very similar. Our mission and our commitment to service are exactly intact. And I guess in measure, the fact that our Board of Trustees will continue to oversee the activities of Trinitas in conjunction with the activities of our newly formed partner, RWJBarnabas. And that's a wonderful way to keep our community intact and in the same line of thinking with RWJBarnabas. So we're very, very pleased and proud today to be here and to become part of this great system. Thank you. And now I'd like to introduce the President and CEO of RWJBarnabas, Barry Ostrowski.
Thank you, Vic. Good afternoon, everyone. To old friends and new friends, current family members and new family members, it's a great day for all of us. Today we celebrate perhaps the culmination of a transaction, but what we really celebrate is what you've heard already. Our joint mission, our joint cultures, and our commitment to those who need our help. We have tried to distinguish ourselves, as Trinitas Regional Medical Center has itself, by serving our communities in ways that go beyond medical care. We believe it's our obligation to invest in our local communities through economic development, through social programs that address the social determinants that keep people unhealthy and otherwise from enjoying their lives. And when we look for partners, we find Trinitas at the top of the list for its commitment to the very same issues and very same communities that we have served. Every organization needs great leadership, and I am so proud and delighted that Gary Horan, our CEO at Trinitas Regional Medical Center, and we were able to sit down and put this great combination together. Vic, as chairman of the board, and Mark Burson, who you'll hear in a minute, are great trustee leaders, and Sister Maureen has always been there to make sure that the mission is accomplished in a fine way. So today we celebrate joint missions, joint cultures, joint commitment, and it's a celebration not simply here, but a celebration across the entire system. To our new friends and colleagues, welcome to the family. We already ourselves feel welcome, and I want to thank everyone for the great work that's been put in to make this a reality, and we look forward to celebrating many more occasions in which the mission that we're on continues to be successfully attained. And so now I'd like you to hear from the chairman of the board of RWJBarnabas Health, Mark Burson. Thank you.
Thank you, Barry. I'm excited to be here today and wish everyone a congratulations on the coming together of these two great organizations. Yesterday's news is that we were apart. Today's news is about the future. And the future is to continue to do what we've each done, but to do it together and expand those services and do great things. As healthcare is changing, we're both going to be very much a part of it as we move forward. Several years of planning, and here we are. One of the foundations of the system, the RWJBarnabas system, is the local boards. And we made decisions early on, the local recognition and the serving the community and being part of the community. That's expanded in recent years to serving all of the communities with a real focus on the underserved. And this acquisition brings together the Elizabeth with our system, but also it immediately had thoughts for me of the fact that Elizabeth and Newark started as one. And having spent some 18 years as chair of Newark Beth Israel Hospital, I know about this partnership and about the communities that we're serving. And I can't appreciate and communicate about how I appreciate what this means, and history helps teach us about what the future can and maybe should be. The fact that the hospital has such strengths in behavioral health at a time when it's so necessary, where you've been involved in teaching and the nursing school, which headlines make it very clear that there's a nursing shortage, and this is such an important occupation for promoting decisions really well made. You're a trusted safety net hospital. We have safety net hospitals, and we're continuing to provide this safety net for the folks that need so urgently the care. So with that, I just again want to thank everyone, look forward to the shared future, and I want to invite Sister Maureen Shaughnessy to please say a few words.
Thank you, Mark. Let me begin by wishing everyone a blessed, happy, and safe 2022. It is good for us to have this opportunity to celebrate Trinitas Regional Medical Center joining RWJBarnabas Health. The mission of both is so closely aligned that the coming together should be a smooth one. This common mission is about a service of caring for our patients, our communities, and each other. A service of both excellence and compassion, a sacred calling which demands the best of us each day. For Trinitas, this is rooted deeply in our Catholic identity, which will continue to be the hallmark of Trinitas under the sponsorship and oversight of the Sisters of Charity of St. Elizabeth. All Trinitas facilities will continue to adhere to the standards of care as stated in the ethical and religious directives issued by the United States Conference of Catholic Bishops. Being part of RWJBarnabas Health will strengthen our ability to provide compassionate care to our communities, especially for those in the community who are underserved and marginalized. We face the changes that are transforming healthcare every day, supported by the state's largest academic health system, while retaining our Catholic culture, which has shaped Trinitas and our role in this community since its beginnings in 2000. We owe a debt of gratitude to the Elizabethtown Healthcare Foundation, which was the other partner in the creation of Trinitas in 2000, and who over these many years have supported the mission in so many ways. As we move forward, as Gary said, we will be guided by the characteristics that define us. Let me close with this brief prayer. Good and gracious God, giver of all good, bless this beginning of a new phase in the journey of Trinitas Regional Medical Center, as it joins the RWJBarnabas Health System. May this coming together benefit all in Elizabeth and the surrounding communities, that they may receive excellent health care through a variety of means. May the administration and staff of Trinitas Regional Medical Center and of RWJBarnabas Health experience a renewal of their commitment to the service of all who come seeking care. We ask this in all the holy names of God. Amen. With this, I turn it back to Gary. Thank you.
Now for the main event. You know, we ushered in a new year. We ushered in the first baby born in the state of New Jersey. And now we're going to usher in a new beginning for Trinitas as part of RWJBarnabas Health. So, Gary?
Never hung a sign before.
Ready? Start with the countdown?
Go right ahead.
5, 4, 3, 2, 1.
Truly exciting day for all of us. You know, signs say so much. It's very important, of course. The Trinitas Regional Medical Center is prominent. Its culture, its commitment to the community on all campuses. That sign will mean continued commitment, continued benefit for those who live in our communities. We couldn't be more delighted to have Trinitas in our organization. It's always great when a family expands, and to include you all as our new friends and family members, together with great folks I think you'll meet around our system. This is truly a match made in heaven. Thank you, Maureen. Anyway, let's celebrate today, let's stay healthy, and let's enjoy this great partnership. Thank you so much.
Trinitas Regional Medical Center, we've added more than 5,000 hospital beds and nearly 20 times the number of doctors and nurses. In fact, we now have the state's largest cardiac surgery and TAVR program and one of the largest behavioral health networks. Plus, we now have a partnership with Rutgers Cancer Institute of New Jersey. How are we bringing all this to Elizabeth? Trinitas is now part of RWJBarnabas Health. Let's be healthy, together.
Very good.
Thank you, Mayor.
Congratulations, Maureen. Those buttons are powerful.